Welcome to Tell Me More, Your Pelvic Floor. We're going to cover a couple of different things today. WTF is the pelvic floor? That's a question I get asked a lot. Why do I need to know about it? And who can help me? So those are the three questions that we're hoping to answer today by the end. So I'm Jayme Filgiano. I'm a registered physiotherapist and pelvic health provider. You can find me at the Physio Spot, a boutique clinic located in Markham, Ontario. And you can kind of see behind me, this is part of our clinic here. So we're just doing this webinar today from the clinic. So did you know that pelvic floor dysfunction is more common than you might think? 1 in 3 women have incontinence, and incontinence is just a fancy word for leakage. 1 in 4 women will report painful intercourse. 50% of Paris women will experience a pelvic organ prolapse, and Paris women just means that you've had children. And prolapse is a word for when one of your internal organs that sit inside of the pelvic area start to shift a little bit. And that's what the word that we use for prolapse. Only 1 in 12 people will seek help for their pelvic health concerns overall, which is really quite a low percentage considering the number of people that do have problems. This is one of my favorite things to tell patients. It is a misconception to think that it is normal to have leakage. Leakage is common, but it is not normal. All of the moms out there that are listening today, I'm sure that you've had conversations with your friends about leakage and how everybody pees their pants and it's just normal postpartum. It is a common thing that happens, but I really like to reiterate to people that it's not normal and it is something that we can improve upon. So if you're having those conversations with your friends, please tell them that it's not normal and there is something that you can do to get help for it. So now I've got everyone thinking, tell me more. It's not normal. What do I do now? So we're going to cover a few different things like we talked about before. WTF is the pelvic floor. What is pelvic floor dysfunction? What is pelvic health physiotherapy and what do I do? And I'm going to answer your questions along the way or towards the end, whatever everyone is most comfortable with. WTF is a pelvic floor and what does it do? Everyone has a pelvic floor, although there are anatomical differences between men and women. The pelvic floor is a set of muscles, ligaments, nerves, and connective tissue that are shaped like a hammock and located within the pelvis at the base of the spine. So on my screen here, if everyone can kind of see my little blue arrow, we've got a red area in the middle here, and then on the outside, you can see the base of the pelvis. This here is your lumbar spine, so we're looking at a bird's eye view. And then the front here is your pubic bone at the front. This is a female pelvic floor. So we're going to see 3 different openings in the female pelvic floor. So this would be your urethral opening. This here is your vaginal opening. And then towards the back here is your rectal opening. So obviously in men, they don't have a vaginal opening, so there would only be 2 spots there rather than 3. Your pelvic floor silently does its job, allowing you to function without interruption. So it's something that should do all the work without us having to think about it. And it has 5 main functions that I like to talk to my patients about. The first one is sphincteric control. The second one is support and stability. The 4th one is sexual function. And the 5th one is a sub pump for your lymphatic system. And we're going to cover each of these a little bit more in depth so that you understand what the pelvic floor does throughout the day when you're not even thinking about it. So the first one that we're going to talk about here is control. So opening of the bladder and opening of the rectum. On my picture, you can see this is the pelvic bone at the front. Okay, and this is the coccyx at the back, which is at the bottom of your sacrum. And this is the pelvic floor that attaches like the hammock from the front to the back. Okay, and what we can see here is that the bladder is actually at the front here. Okay, this is your vaginal opening and your uterus, and this is your rectum at the back. Okay, so once again, in males, we wouldn't see the uterus or the cervix or the vaginal opening. There would only be the bladder and the rectum. And you can see that the bladder and the rectum actually pass through the pelvic floor. The pelvic floor helps to control those openings so that we don't get things like urinary leakage or fecal incontinence either. So it helps us to maintain control throughout the day, and that's how we function normally. The pelvic floor is also important for stability. So it helps to support our internal organs. We just showed you that on the last slide. So it helps to support the bladder, the bowel, the rectum, and the uterus. And it also helps with the stability of the hips and the low back. So if we look down here, all of this in red, once again, is our pelvic floor, okay? These muscles here, your piriformis and your obturator internus, are two muscles that actually attach to your hip. So they help with the stability in your hip. And those muscles actually are part of the pelvic floor as well. So I like to talk about hip stability with my patients. And then the other thing that I like to talk about is over on this slide here. You can see once again, we've got our pelvic floor at the bottom. And then we've got another 3 groups of muscles. And these muscles are your diaphragm. So that's the muscle that sits underneath of your ribs. We've got your transverse abdominis, which is the deepest layer in your belly muscles. And then we have your multifidi, which are some of the back muscles that attach to your spine. These 4 muscles all work together and they act as your inner core or your deep core, some people like to call it. And this is a really important system in our body. It's a system that is just like the pelvic floor, always working by itself and providing us stability for our different types of movements and activities and exercises. It is something that should be working without us thinking about it, but sometimes what starts to happen is that that system doesn't work in such a coordinated manner anymore. And that's when we can develop problems in our hips and our low back. So it's a really important system for the stability of our lower body. The pelvic floor is also important for sexual function. It's important for orgasm and blood flow in both men and women. So the pelvic floor muscles contract and relax rhythmically in women to help them achieve a full orgasm. And then in men, it helps them to maintain an erection as well. So it's really important for sexual function. And sexual function is something that I'll discuss with my patients pretty often to find out if there's any discomfort, if anyone's having any difficulty with anything. And it's something that I can help you problem solve and work through a little bit. Now I've gathered everyone's attention. You're saying, tell me more, Jayme. So are you ready? Here it comes. Pelvic floor dysfunction. So that's when people come to see me, is when they have dysfunction in their pelvic floor. When your pelvic floor is too tight, too weak, uncoordinated, or experiencing other types of dysfunction, it can lead to things that I've listed on the side here. And we're going to go through these a little bit more in depth. We're going to talk about urinary incontinence, that's leakage, okay? Constipation, which is self-explanatory, dyspareunia, which is pain with sex, pelvic pain or pressure, and then hip or low back pain. And we just talked about the hip and low back pain a little bit on the last slide. So there are some risk factors for incontinence. That's our number 1 on the list, urinary incontinence or leakage. And some of these that I've listed below here can predispose you to having a higher level of urinary incontinence. So it's more common in women, about 85% of cases. In people who are obese, they can experience more incontinence. When you're postmenopausal and your hormones are changing, if you're over the age of 40, if you've had a pregnancy and or you've given birth, if you've had gynecological or urinary surgery, chronic illness, smoking, or chronic straining. And I get asked sometimes about the chronic illness and the smoking, and quite often that is linked to cases where people are coughing a lot. And when you cough a lot, you increase your intra-abdominal pressure, and that system that we talked about with your diaphragm and your pelvic floor, it's going through a lot when you're coughing that amount and putting a lot of pressure on the pelvic floor. And then we can see some dysfunction come out of those cases. That also happens in cases with chronic straining where maybe someone is constipated really frequently. So dysfunction, it can be incontinence for any reason, okay? So if someone is having leakage with exercise, weightlifting, laughing, coughing or sneezing, those are all really good reasons to come and see a pelvic floor physiotherapist. If you're having urinary urgency, which is when you have to go to the washroom urgently without the loss of urine, okay? So those are my people that are like, Jayme, I have to run to the washroom, otherwise I feel like I might lose control of my bladder, or I just feel like I have to go really often. And that kind of leads into our next one, which is urinary frequency. So people who have to go to the washroom really frequently throughout the day, it often interrupts their schedule, it interrupts their activities of daily living. So I work with people to try and decrease their frequency of going to the washroom. And I like to tell people that normally when you go to the washroom, it should be about 5 to 8 times a day. Okay, so every 2 to 3 hours on average. And if you're over the age of 55, going once in the middle of the night is really common as well. And when you're going to the washroom more than 8 times per day, it can cause dysfunction in your bladder and in your pelvic floor. So that's something that I can help people with so that they can get back to their normal schedule, their normal routine, instead of being in the washroom over 8 times in the day. Another thing that I like to talk to people about is nighttime urination or bedwetting. That's something that can be addressed with pelvic floor physiotherapy as well as constipation, straining, or pain with a bowel movement. So if you're experiencing constipation frequently, it's something that we can improve upon. And your pelvic floor does play a role in constipation, because when we looked at the rectal opening, we saw that the pelvic floor muscles actually go around the rectum. So your rectum comes down like this and your pelvic floor muscles go around it. And if those muscles are really, really tight or they're not working properly, it can cause you to be more constipated and have difficulties with bowel movements. Another piece of things is a pelvic organ prolapse, and we talked about that a little bit earlier on today. A pelvic organ prolapse is when one of your internal organs has shifted or moved a little bit and it's no longer sitting in the position that it originally had. So sometimes people's bladders or their rectums can kind of tilt inwards into the openings, and that's when we diagnose someone with a pelvic organ prolapse. And I discuss that really thoroughly with my patients if it is something that comes up, and it is something that's more common than most people would actually know. Lastly, painful intercourse or vulvar pain is also another type of pelvic floor dysfunction. So I see a lot of women, and sometimes men as well, that have pain with intercourse, and people just attribute it to being a normal part of their experience. And I like to tell people that it is something that we can make better by working together and working with your partner to make it a more pleasurable experience for you. Sex should never be painful. It should be enjoyable. Pre and postpartum. I do see a fair amount of women pre and postpartum, and for different reasons than a lot of people might think. So the pelvic floor, obviously, when you have a cesarean section, is not necessarily affected because they're cutting through your abdominal tissues. But there's a lot of fascia and muscles that they cut through that do attach down into the area of the pelvic floor that can be affected. So I do like to see people after a cesarean section, and I help them with their pelvic floor, but also with things like how their scar is moving and how their abdominal wall is doing. Women with diastasis recti or men with diastasis recti can also come to see me as well. And diastasis is when you have a separation in your belly muscles. So if you think about your 8-pack on both sides, it's when your 8-pack pulls apart just slightly in the middle and creates a little bit of extra space than there normally would be. And when we talked about that inner unit, the transverse abdominis and the pelvic floor and the diaphragm and the multifidi, those are all things that we can retrain to help someone who has diastasis recti. I also love to see people for returning to exercise postpartum or even during pregnancy. I like to make sure that you have a pain-free experience when you are exercising or when you're trying to get back to exercising after pregnancy. Pain is something that, once again, is really common, but it's not necessarily normal, and it's often something that we can improve upon with a little bit of retraining. Postoperative gynecological, abdominal, or urinary procedures are also another good reason to see a pelvic floor physio. Whenever you have surgery, you can have things like scar tissue that get laid down. Sometimes your muscles can become a little bit more tense, or your muscular system can become a little bit more uncoordinated. So I like to see people after those types of procedures as well. If you experience pain, spasm, or pressure in the vagina, rectum, or pelvis, that's another great reason to seek out help from a pelvic health physiotherapist. Those are all symptoms that can be driven by referred pain from the pelvic floor or direct pain or discomfort from the pelvic floor. This last one here, I think is a really important one. It's something that not a lot of people actually know about. So chronic and or unexplained pain that has not responded to treatment in the hips, the pelvis, and the low back. So when people say to me, I have been going to my physiotherapist or my chiropractor or my massage therapist for this hip pain or this back pain for a really long time, and I haven't seen any improvement, I'll often suggest that we maybe take a look at the pelvic floor if it is indicated, and it can give us a little bit more information. So like you saw before, those muscles in the pelvic floor actually attach onto the hip, and it attaches onto the sacrum, which is directly attached to the low back. So if you're having problems in those areas, sometimes the pelvic floor can be the driving force, the primary reason, or it can be a contributing factor to your symptoms. So I like to see people that have had that unexplained pain for a long time to see if there's anything that I can do to help you. We also treat conditions including endometriosis, dyspareunia, which is pain with sex. We've mentioned that previously, vaginismus, menopause, interstitial cystitis, bladder pain syndrome, vulvodynia, vestibulodynia, prolapse, and persistent pelvic pain. And if you don't know what some of those are, it's probably because you don't have them. But if you are ever diagnosed with any of those, just know that a pelvic health physiotherapist can help you with your symptoms. So another thing that people love to ask me is, can't I just do a bunch of Kegels? Is that not the answer to all my problems? And when you do research online, Kegels is one of the first things that will come up to help you with your pelvic floor dysfunction. And this is kind of the answer that I give to people when they ask me that. So the short answer is no. Kegels don't just solve all of your pelvic health problems or your pain or discomfort. Dr. Kegel invented a series of exercises to strengthen the pelvic floor after childbirth to reduce incontinence. While they are still useful for someone who has a weak pelvic floor, it is challenging to know the general condition of your pelvic floor without proper examination. So you could actually do more harm than good with Kegels if your pelvic floor muscles are short and or tight. And I'm going to show you a picture on the next slide that kind of demonstrates what happens when you do Kegels when your pelvic floor is really tight. So I really like to reiterate to people that I want you to be sure that you check with a pelvic floor physiotherapist before starting any pelvic floor strengthening programs. Because if you're doing Kegels when you shouldn't be, it can actually contribute to your symptoms getting a little bit worse. So the pelvic floor muscles should have some natural give. They absorb impact, contracting and relaxing as needed. So if we take a look at my 3 different hammocks over here, these are representing the pelvic floor. And if we think about the pelvic floor, at the front here, it would be attached to the pubic bone. And at the back here, that's where we have the attachment to the sacrum. Okay, and that sacrum is the kind of like near your tailbone that attaches to your low back. Now, in some people, we see pelvic floors that are actually really, really tight. Okay, so on examination, they have really tight pelvic floors. And when you have a really tight pelvic floor, it can lead to things like pain and discomfort, loss of mobility through your hips, or difficulty controlling your bladder and leakage as well. And the reason for that is that when your pelvic floor is really, really tight, it has a hard time contracting. So I'll often show my patients my biceps analogy. If you have a really tight pelvic floor, it's kind of like trying to do a bicep curl with your arm starting here. And if I asked you to lift 25 pounds here, it'd be really difficult. If we can straighten our arm out all the way, it actually makes a bicep curl a lot easier. So in people who have a really tight pelvic floor like this, we actually want to work on relaxing the pelvic floor first, rather than just doing Kegels and trying to strengthen it right away. And for those of you who don't know, a Kegel is a pelvic floor contraction where you try and contract all the muscles around the bladder opening and the rectal opening, and it feels like there's a little bit of a lift in your pelvic floor. So that's kind of the first case, is that if your pelvic floor is really tight, sometimes we need to work on relaxing it before we can actually strengthen it. And if you do try and strengthen a tight pelvic floor, it can actually make it tighter, and it can make your symptoms even worse. So that's why we always tell people to try and get an assessment done before they start doing Kegels. This pelvic floor in the middle here would be something that we would be looking for. It's got a nice length to it. There's lots of room for it to contract, but it's still giving a nice amount of support to those internal organs, so it's not too loose. This bottom pelvic floor here is something that we also don't love to see, and it's something that we can actually help you improve. So if your pelvic floor is like that, some people might describe it as a little bit too droopy or too relaxed. And in that case, it can actually be a little bit more difficult to control the opening around your bladder and around your rectum, and you might have some incontinence. The other thing that something like a droopy or relaxed pelvic floor can lead to is those internal organs might be a little bit more wobbly than they normally are if they had really nice support underneath of them. So sometimes that can lead to something like a prolapse. And the other thing that I like to tell people that have a pelvic floor that might be a little bit too relaxed is that we have to think about that nice deep inner core and how it works. And if your pelvic floor is not doing its job, it means that other parts of your core have to do more of the work. So we want to make sure that the work is nice and evenly spread out and that your pelvic floor is engaged and working the way that it should be. So that brings us to pelvic health physiotherapy and kind of what my role is. So pelvic health physiotherapy, it's also known as pelvic floor physiotherapy or pelvic physiotherapy, is the assessment and treatment of various conditions that involve the pelvic floor or symptoms that manifest in that area. And we're going to go through kind of what I do during a typical assessment so that you get a good idea of what you would be walking into if you did go in for a pelvic health assessment. Pelvic health therapists have advanced and specialized training to perform external and internal assessment, either vaginally and or rectally, of the pelvic floor to determine if it could be contributing to your symptoms. And we'll go over what vaginal and or rectal assessment means a little bit later on. So during the first appointment, typically if you were to see someone like myself or any other pelvic health physiotherapist, it's around an hour for the first appointment. And we talk to you about all the things that we've kind of talked about so far. So what's your bowel and bladder function like? I'll ask you how often you go to the washroom, how much you're drinking during the day, what types of things that you're drinking during the day, if you have any pain or straining when you're going to the washroom, what your stool looks like. So those are some of the questions that I ask. And I always tell people ahead of time that pelvic health physiotherapy is a little bit different than normal physiotherapy. And I do ask you some questions that are a little bit more personal. And obviously, if there's any questions that you prefer not to answer, you don't have to. We can always just move on from them. I'll also ask about sexual activity because of the role of the pelvic floor in your sexual health, your gynecological history, your sleep and your stress. And I get questions about that one sometimes. Why do I want to know about your sleep and your stress levels? Well, your pelvic floor actually reacts really strongly to your stress levels or your anxiety levels. So if you are chronically stressed or chronically anxious, it can actually make your pelvic floor get really tight, kind of like your neck muscles do. So your upper fibers of your traps, when people get stressed or anxious, they do this. And your pelvic floor actually does the same thing. So if you're stressed or anxious, your pelvic floor actually gets really tight and lifts up as well. So I like to know what people's levels are like so that I get an understanding of the person as a whole and not just your pelvic floor. I'll ask you about your general health overall, if you've had any surgeries or any types of interventions. And I also want to know what your goals are. So everyone's goals vary. Some patients that I see say to me, I just don't want to wet my pants when I walk in the front door, because the second I walk in the front door, I have complete leakage. And other people will say to me, when I do box jumps at CrossFit, I have leakage, and I really want to make sure that I can do box jumps without leakage. So there's definitely different types of patients that I see, and I love treating all of them. I love helping with exercise. I love helping with function. So I like to really establish what our goals are so that I know what we're working towards. So in terms of the assessment, once we're done talking about everything and I've been able to ask you what all of my questions are, and you've been able to ask me if there's anything that you're uncomfortable with, we move on to the actual assessment. And the external assessment might involve the assessment of your posture, your lumbar spine, your sacroiliac joints, and or your hips. And your sacroiliac joints are just the joints between kind of your tailbone and your hip bones on the side. We also look at your abdomen, so what your muscles are doing in your belly area, if there's any diastasis at all. I like to look at people's breathing because of the diaphragm's involvement with the core. And I'll also take a look at the external pelvic floor if someone is comfortable with that. So when we look at our pelvic floor, I'm just going to grab my model here. This is our pelvic floor here. The external pelvic floor muscles would be these muscles on the outside here. So that's what we would start off with looking at when we're doing an external assessment. I really like to let my patients know that even if you choose not to participate in an internal exam, we can still provide you with an effective treatment plan as we take a whole body approach to the assessment and treatment of your condition. And some people are not comfortable with doing an internal examination when they first meet me, or maybe it takes a few visits before they decide that they would like to do something like that. And we go at everyone's own pace and make sure that you're comfortable with what we're doing. So the gold standard of doing a pelvic floor assessment is actually doing an internal examination. And I'm just going to show you, so hopefully you can see me on my small screen at the top there. This here is my model, okay? So we saw this a little bit earlier, and we saw the bird's eye view where we saw the hip bones, and then we saw the pelvic floor on the inside, and the pelvic floor is everything that is red on the inside. Now, when we look at the outside, okay, there are 3 muscles of the pelvic floor on the outside, and they're in the shape of a triangle. And those are the only 3 I can get to from the outside. For an internal examination, I can get to all of those lovely red muscles on the inside, which is why it's the gold standard. We want to make sure that we're getting as much information as we can, and that we're not just kind of hypothesizing or guessing about what's going on internally. And when we do an internal examination, we're looking at the strength, the tone, coordination, and endurance of your pelvic floor. So just like someone or a physiotherapist might palpate something like your hamstrings or your quadriceps to see if there's any kind of tight areas or nodules, we do the same thing in the pelvic floor. So we actually palpate those muscles and we see, is there any areas that are a little bit sensitive or a little bit tight? And then we end up treating those areas that we find that might have a little bit more tenderness or sensitivity. We also look at your strength. So when we were talking about Kegels before, we talked about how not everyone has to do Kegels. And people can often do Kegels wrong. They think that they're doing it right, but unless you have an internal examination done, you'll never actually know if you're properly doing a Kegel. So we actually assess your Kegel internally with 2 fingers placed vaginally or rectally, or 1 finger rectally. And we ask you to do a Kegel, and we see, is there a nice contraction through your pelvic floor, or are you having a really hard time recruiting your muscles? Let's talk a little bit more about these hammocks again. So which hammock represents your pelvic floor? Is it tight and short? Is it just right? Or is it too droopy and relaxed? The best information that we can gather is from that internal assessment about what category that you fall into. And once we know how your pelvic floor is reacting or behaving, then we know how to appropriately proceed with intervention. So that's why I really recommend it, because it's the gold standard, but it is completely up to everyone's comfort level if they're willing to do an internal assessment or not. So in terms of treatment, research has demonstrated that pelvic health treatments are highly successful and should be the first line of defense before surgery or any other medical intervention for both pelvic pain and incontinence. So I will have people that get sent to me by their surgeons because their surgeons want them to try non-surgical intervention first to see if there's any improvements. And there are quite a few doctors that will also refer people to me that have problems with incontinence or leakage, because we're actually the first line of intervention. And the most success is seen when someone sees a pelvic health therapist for these types of problems. What can treatment include? This is a really short list to try and capture everything that is included. But what can be included is internal and or external manual therapy. What that means is that if we were doing an internal assessment and maybe we found an area in your pelvic floor that was a little bit tighter, we might do something like a little bit of a massage, or some people refer to it as a trigger point release to help you relax those muscles. We might also give you something like feedback internally in your pelvic floor to let you know which muscles I need you to turn on a little bit more. So I might kind of tap the muscle to the side and get it to wake up a little bit so that it contracts a little bit more, or we're working on releasing some of the tension in your pelvic floor. In people who experience things like vaginismus or vestibulodynia, where they have really high levels of sensitivity, we can also work on desensitizing your pelvic floor and your vulvar area or your vestibule area to help with that overall sensitivity. We can also work on things like stretching, exercise prescription. I love to do exercise with my patients to work on that deep core like we talked about earlier. Activity modification, talking about things that are good for you right now, or maybe things that we need to work up to a little bit. education and bladder retraining. So in my people that typically go to the washroom more than 8 times a day, we actually need to work on retraining their bladder to empty every 2 to 3 hours instead of emptying every maybe 1 hour or 2 hours. And that takes a little bit of training from the perspective of your bladder relearning how to hold more fluid into it. But that's something that I'd go over with you personally if you're experiencing something like that. And then the desensitization techniques we already covered in terms of some of those cases where the pelvic area might be a little bit oversensitized. It's time to become friends with our powerhouse muscles down there. It's empowering. And I want everyone that is here today, and I know some of you personally, so I'll be checking with you to make sure that you told a friend. I want you to tell your friends about it. And I want you to tell your friends the thing that we talked about earlier, that leakage is really, really common, but it's not normal as well. There's lots of things that pelvic health physiotherapists can do to help you. And we're always willing to work with people at their own pace and at their own rate to make sure that they're comfortable with what we're doing and what we're going through. And I like to tell my patients too that I always talk a lot during our assessments and during our appointments, but it's just because we want to make sure that you have a really, really good understanding of what we're doing to your body and what we're asking your body to do so that we can have the most success. Thanks everyone for coming, and I hope everybody learned something today.